So you said that healthcare is a right, not a luxury, and that it's directly tied to the economic security. What does your vision of healthcare justice look like in the US Senate?
Well, Medicare for all, I think, is a good model. And Bernie Sanders and others just introduced legislation to try to move that again. And I think, honestly, if the Democratic Party could just get behind that single policy, it would go so far to helping this country and really restore people's faith in the party again. So that's really important. Our current health system, I'll just tell you that I wasn't sold on Medicare for all initially. I ran against Michael Bennett in 2022, mostly just trying to kind of inject progressive ideas into the political dialogue. And I did pretty well without really having much of a campaign. I got 19% of the vote at the state assembly. I needed 30 to get on the ballot. But I tell you that to tell you that when I was researching the platform that I was going to use, I dug in on the Medicare for all, and I thought, well, I can see some value to having some competition in the medical field. You want innovation, you want competition so that there's better quality. So those are the things that were kind of kicking around in my mind. But when I did the research, comparable wealthy countries like ourselves, we have poorer outcomes at a higher cost. And that sold me. I'm like, this makes no sense. We're not getting better outcomes, and it's very costly. And, it just does not make any sense anymore. And Obamacare was kind of a halfway measure, I think, between, a single payer program like Medicare for all versus, what we had before Obamacare. But my sister, who is 55 years old and in good health, her premium under Obamacare is $500 a month. Now, who can afford that? I mean, you know,
I mean, not especially if you're having to go to Obamacare and you're not actually getting healthcare from your job. More than likely, you are either paying taxes by doing 1099 work or you're working multiple jobs that don't offer benefits. So
yeah,
nobody.
yeah. I mean, and
Uh,
they're reasonably well fixed. So, if they were worried enough about it, they'd probably go ahead and pay for it. But how many people are able to do that? I mean, it's an extraordinary expense. And we also have an issue with the equity piece, as you pointed out. Like, Black women have an unacceptably high mortality rate as mothers, as through the pregnancy process. We've got to get to the bottom of that. And then rural health care, that's got to be improved. And we've just, as a society, we sort of stopped dreaming big. We stopped dreaming about how we could make everyone's lives better. And we just started to normalize the dysfunction. And I think just speaking about the dysfunction and acknowledging it and agreeing to address it, trying to get some bipartisan agreement about addressing it, is a step in the right direction to dealing with the dysfunction and improving the equity.
so now 39% of the state of Colorado is on Medicaid, Medicare, or CHIP, which I'm assuming is the Colorado healthcare program. What do you say to people who are one ER visit away from financial ruin, or even worse, avoiding their care altogether due to financial difficulties?
That's a political question that requires political activism. I can't do anything as a candidate, and even as a US senator, I couldn't directly fix that individual's problem. But by God, I can go to Congress as a member of the US Senate and push for legislation that prevents problems of that sort from burdening people. Because until we make a change like that, those kinds of examples will just persist. And it's unacceptable in a society as wealthy as ours. It makes no sense from a policy standpoint